When young children have a fever, it can be difficult for most parents to work out why. Does your child have a fever and you're not quite sure what to do? Is this something serious? When should you worry and call your doctor? Well, most fevers in young children are due to non-serious viral infections. Um, for some viral infections, it can take up to 48 hours of fever before other symptoms develop. In this video, we are going to talk about what are the causes of fever, what is the correct way of taking your child's temperature, what are the reassuring signs, what are the signs that your child is unwell, what are the signs that your child is seriously unwell, and when should you worry and call your doctor. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Fever and when to worry. Fever in children usually indicates that your child has a higher temperature than normal. Well, the normal body temperature can vary a little, but when you get a temperature of 38 degrees Celsius or higher, then your child definitely has a fever. Fever in children means that they usually have an underlying infection. This is a cause for worry for most parents, and understandably so. When your child is 3 months old or younger, it is unusual to have a fever and definitely a cause for concern. When your child is 3 to 6 months of age, there is a higher chance that it is a serious infection. Now, when your child is 6 months or older, most infections at this age are not that serious. Why do children get fevers? Well, fever is the body's natural defense against infection. Fever is caused by the immune system as directed by the part of the brain known as the hypothalamus. Now, the hypothalamus acts as a central heating thermostat, and it is responsible for setting the body's temperature higher than normal. It does this when it detects germs in the body, such as bacteria or viruses. It is believed that a higher temperature protects the body. What are the causes of fever? Well, the most common causes of fever in children are viral infections. Some of the common viral infections in children include cough, colds, flu, diarrhea. Viral infections can also cause more serious infections. Another cause of fever are bacterial infections, which can be more serious, such as pneumonia, urinary tract infections or other kidney infections, joint infections like septic arthritis, septicemia, and meningitis. Bacteria can also cause less serious infections, such as ear infections and infected skin rashes. Other causes of fever include inflammatory conditions such as Kawasaki disease, other forms of arthritis, and reactions to medications. Immunizations can also cause fever. It is a way of tricking the body into thinking it sees an infection so that it develops immunity. Fever from immunizations are usually not that high and are not that prolonged. Another cause of fever are tropical diseases, which can be found in developing countries such as malaria, tuberculosis, and dengue fever. Now, how to measure your child's temperature? Well, forehead strip thermometers are not very accurate. You should do one of the following. If your child is less than a month old, you can use an electronic thermometer in the armpit. If your child is 4 weeks up to 5 years old, you can also use the electronic thermometer in the armpit or use the thermometer that is placed in the ear. When does fever indicate a serious illness? Well, some of the symptoms of common viral infections can be similar to symptoms of more serious infections. It can be difficult to determine whether your child's fever should worry you. In the next slides, we will discuss some of the signs that indicate that your child has a serious condition and whether you should seek medical advice. What are the reassuring signs about your child's illness? If your child has normal skin color, normal lip and tongue color, he or she should be okay. If your child has moist lips and tongue, if your child appears content or is smiling, if your child is not crying or has a normal cry, if your child is awake or wakens up from sleep easily. Now, what are some of the features that your child may be more unwell? If your child is 3 to 6 months of age and has a temperature of 39 degrees Celsius or higher, when your child has pale skin, lips, or tongue, if your child is not normally responding to you, not smiling, wakes up with prolonged effort, if your child is not wanting to do anything, if your child is not feeding well, if he or she has dry mouth and lips, if there are decreased wet diapers, if your child has attacks of shivering, if your child's fever has been going on for 5 days or more, if there is swelling of a limb or joint, and if your child is not moving his arms or legs. Now, here are the features that suggest that your child might be seriously unwell. If your child is 3 months old or less and has a temperature of 38 degrees Celsius or higher, when you note pale, mottled, ashen, or bluish skin, lips, or tongue, if your child is not responsive to you, if your child does not wake up, or if you wake him, does not stay awake, when you hear grunting noises when your child is breathing, if there is indrawing of muscles between the ribs, when your child's fontanelle or soft spot in the head is bulging or sunken, and if your child has a seizure. And now, what are the signs of dehydration? Well, a child with a fever can feel icky and irritable and may not eat or drink as much as they need to. Also, a child with a fever can also have an accompanying nausea, vomiting, or diarrhea. And in this way, dehydration can set in quickly. What are the features and signs of dehydration that you should watch out for? If your child has dry mouth or tongue, when there are no tears when your child is crying, when there is a sunken appearance in your child's eyes, if your child is drowsy with cool hands and feet, generally when your child appears to becoming more unwell, when there is also reduced skin elasticity, when there are decreased wet diapers, or when baby is passing less urine, you should seek medical advice for these things. Hey, if you enjoyed my video, watch my other videos where I teach you about other child health problems.